for joining us, Dr. Tarek. So Dr. Tarek, he is a consultant, PICU consultant, pediatric intensive care consultant in National Guard Hospital, King Abdullah Specialty Children Hospital in Riyadh. And we thank him for volunteering to do this lecture. He's going to talk about COVID-19 syndrome program. Join me in welcome him in our lecture. And we'll keep all the question at the end of the chat. So if you do have any question, please type it in. We will finish around 7:05, since we started 5 minutes later. And we will try to finish all your questions. And if you do have any suggestion and other lectures or speaker, just write it in the chat and I will raise it up to the committee. My name is Amani. I'm the head of the Public Relation Committee in the society. And you can also email me or Twitter me or anything. You can contact us in any way in the social media, Twitter, Facebook, LinkedIn, and the website as well. تفضل دكتور طارق.
مساء الخير. Thank you, Dr. Amani, for this nice introduction. It is always a pleasure to be with the Saudi Society for Simulation in Healthcare. Really, I'm happy to be in this great team. I'm happy to be with you today, talking about the COVID Sim Drill program. I'm Dr. Tarek Hazwani. As Dr. Amani said, I am from National Guard in King Abdullah Specialized Children Hospital. I am pediatric intensive care consultant, as well I am the pediatric simulation program chair there in the hospital of National Guard Riyadh. Welcome all of you for this lecture today, for this discussion, panel discussion, rather than a lecture. I want to hear also from you as well. Let's start. Before talking about, I will go with you with a story happened last week with us. Ahmed, 5 years old, was admitted to our hospital night before with abdominal pain. Spent all the night with this pain. And at morning, the surgeon made decision that he had perforated appendicitis. But the story is not simple like that. Ahmed with his family went back to the kingdom 1 week ago from Italy. Highly suspected to be COVID-19. Nurses will prepare to deal with this scenario. So they prepare him in an ideal way. The surgeon aware, they call an OR, please prepare yourself. We have this case as an E1. And they went with the Ahmed to the OR. Everything going smoothly with us. While the anesthesia preparing the intubation and they want to start the intubation, they discover that the OR room, as any OR, positive pressure. What does mean positive pressure? Positive pressure in OR, this is usual situation. But for COVID-19, positive pressure room, that means the COVID-19 will spread to the other 12 rooms in our OR suite. How to solve this problem? And what do you think how to help in this way? For sure, in this way, we need a simulation for that. Because ideally, when we thought about it step by step, we didn't reach for this particular issues here. In COVID-19, we need a simulation drill for that. Why? We need optimal preparation before any outbreak happened in our hospital or in another institution as well. We want to check the readiness also. And to strengthen the prevention rules here and all the steps and the precaution for that. And looking for any gaps in either in the system, in either in the equipment, and either also in the medical or health provider teams here. In our hospital and all the other hospitals in the kingdom or in the global way. In COVID-19, they made a guidelines if the suspected case came to us, how to do and how to deal with it. As well, we have this guideline. This is a new guideline. How to check it? This guideline talking about what? Talking about if we will go with the patient from ER, for example, and we want to admit him in the ward, in which corridor even we will have to pass on it, and in which ward we will admit, and who will care about him. This is the guideline talking about a lot of details. Without the simulation drill, I cannot check how much smooth this guideline will be with us. And it's not only for this, and more for also health providers. All of us feeling fear from this COVID-19 cases. It is in the news everywhere, everyone talk about it here. So we need our team to be familiar with those cases, not over also react. We need logic reaction to that. So with simulation, we are breaking this fear with them also, with the medical staff. In simulation, it will help us a lot. What we did, I'm talking today about our program. I'm talking how we built our program, who was involved in it, and what is the steps, what is the successful steps, and what is the other challenges. That's what we are going to talk about it and discuss with you today. We know in simulation, we are talking about teamwork, specifically in these cases, COVID sim drill. I'm talking about the kind of simulation, what we call it interprofessional simulation. That means different teams involved. I'm not talking about only pediatrician here, or only nurses, for example, or only ER team. I'm talking about multiple teams involved in these cases. So we need to be well prepared for that. What we did in our program, we have our pediatric simulation program in our hospital. We sat with an infection control, discuss what is the challenges we have it with them, because those infection control team, that's the core in prevention of COVID-19. What is the guideline? The new guideline, how to make scenarios. We build the scenarios for that. We make objectives for our program, and also how to evaluate. And then we went live. This program, as I said, it was prepared with different teams, as you can see here. This is a new project here. I'm talking about infection control in collaboration with pediatric simulation program in the King Abdullah Specialized Children's Hospital. In this program here, we build the scenarios talking about only pediatric case, because our hospital is only pediatric. But talking about different level, different scenarios here. As you can see, our hospital is not a small hospital. It's the tertiary centers here, talking about complicated cases here. So we want from our program goals to provide, first of all, who's the team working in cash in our hospital, how to deal with suspected cases or confirmed cases, pediatric cases for sure here. And not only for the medical team as well, also to make our environment, our equipment is safe and well prepared to make this environment safe for our health team, health provider team. As you can, and as you know also overall, when we have a stressful environment, the responsibility sometimes, it will be missed among all the team members here. When we are doing this simulation drill, the responsibility, the rules, it will be also clear for each one here. and we can detect the gaps if we have some responsibility is not clear for those or for the other also as well. In this program, we involve different levels, as I said before. We involve the pediatric wards, those patients admitted to the pediatric wards, suspected or confirmed. The major cases will come to who? To the ER team. So the pediatric ER team. And those they will come to the ER. How to transport them? With the elevator also we will use it, for example. What is the precaution we will take it for the patient and those transport team also as well. So transportation. Some of the cases will be admitted to the ICU. We make a scenario for ICU. And as I said before in my introduction, some of the cases need surgery, emergency surgery. So anesthesia also involved in this program. So you can see here how many scenarios and how many teams involved in our program. What we need from them? Our objective that program to improve the compliance with the infection control precaution checklist related to the COVID-19. We need a compliance to be exceed 90%. Checklist, usually the infection control standard checklist for any airborne. They have a checklist, how we wear our PPE, how doffing and donning also, how to also taking care about the waste also, and how to take care about all the steps of transport and. So we have a standard checklist, and this is almost a standard for any hospital. It's not only customized for only our hospital. This will be standard for any hospital. As well, the other objectives improve the staff knowledge about the COVID-19 prevention methods, how to prevent themselves, how to prevent also the other patient from suspected or confirmed COVID-19. Our program depends on the COVID-19 real cases. That means I will not conduct the scenarios in our simulation lab. What we need to mimic the real cases, because as I said, in our goal to check the system, to check the gaps, if we have a gaps in our system, to check it. It's not only for a training, not only for a knowledge or a practicing. I have an important part, checking the system and guidelines here. So we decided to make it inside the simulation sessions. For both, either for COVID-19 suspected pediatric cases or COVID-19 confirmed pediatric cases. So both, because the precaution, it will be different from 1 to 1. And we build different scenarios. We make different scenarios. For example, we conduct a scenario patient come to the ER with mild symptoms. And then how the triage will deal with him, and to which unit he will be pushed, and how the medical team, how many persons will be involved. In COVID-19 cases, we are trying to minimize those involved in the caring of the patient, because we want to make it limited exposure to them also. So this is one scenario. We make another scenario, a child come to the ER, but have severe respiratory symptoms and signs, and he need acute care. That scenario, it was with us more drama, because we found a lot of gaps here. This scenario, patient require resus room, require upon arrival to the ER, intubation. When I'm talking about an intubation, That means a lot of equipment will be used. A lot of people needed here. Medication, anesthesia, or even an ER team and the respiratory therapists. Other scenario, we make it last a few days ago, that the patient admitted to the hospital, but he required a surgery and general anesthesia. In this scenario, our goal here to check what? To check the anesthesia steps and the OR preparation for that. In which room they will use? Is it will be, for example, the room, the OR room, the middle one, for example, or it will be, we will design a one, minimize the exposure for the other patients. That's also what we went through last week, a few days ago. Our goal overall in these scenarios, because I'm looking for a system check here, to repeat it, because after that, we will generate a report. And then we will do another scenario after 1 to 2 weeks, and to see how many of these issues fix it. And for example, any issues fix it or need to be changed. How many of this change and how many when we need also to work on it and not yet. This is the ER scenario. This is one picture from our real scenarios last week also. Patient that one required intubation in ER. You can see from this photo here, that's not a lot of people around. That's what we need also here, to minimize the people, to minimize the team numbers here as we can here, but at the same time, to provide the optimal care for him. How to evaluate? This is the ER scenario we went through last week. You can see here, we are not one only. I am not alone here. I'm evaluating also infection control with us, checking the team and looking to the team performance inside of the ER room here. You can see that child required intubation. Also, he need chest X-ray. Guess what here? When the technician came, he don't know this is COVID-19, and he was not ready. He has a beer for here, and there is a delay here. Took from us extra 20 minutes to replace technician with one N95 fit test. Without this scenario, without this simulation drill, we cannot check for all of this. The ER team here inside the room, waiting chest X-ray, extra 20 minutes, only for this simple issue. If we will go by paperless, everything will be okay before simulation drill. When we are going to the practice, we will see how many times we will fail from these small gaps here. So how to evaluate? We make a form and we make area by area here, as you can see here. From triage, for example, I'm talking about ER, transportation, and then, for example, ward or ICU or anesthesia. What is the area we can improve it next time? And what is the recommendation from this simulation drill? As well, the other checklist, it will come from the infection control team. Infection control, as you can see here, their standards about the precaution here. If it is, I'm talking about the airborne here, so they have a checklist. How many checklists failed and how many succeed? And then after 1 week or 2 weeks, I want to repeat it again and see how much they get improved here. Evaluation is not easy here because I'm doing this in situ. I'm doing here for multiple level here. So we are trying to make it objective, as we can see here. We can do a lot of issues, a lot of evaluation, but in the same time, I need to be objective, not subjective, because I want to follow it. I want to make it standardized also here. This is the major challenges we have it. But we have another challenges. After 1, 2, third drill, we receive a call. Okay, guys, what you are doing? In each scenario, you are consuming at least 10 to 15 N95 mask. Okay, and you know the shortage of this equipment global-wise. Are you sure do you want to use all of this? So if you want to conduct 1 or 2 simulation drill per week, you are talking about 1 month, how much you will consume. We want to keep it and secure it for real cases, not for simulation drill. How to overcome this challenge here? It was a big challenge for us. Shall we make simulated mask? Yes, we can do it. Shall I ask the team to use the simple face mask? I can do it. But in each step, when I'm doing this, specifically I'm talking about an insight simulation here, I'm losing the realism in this. Because if I'm using simulated mask, I'm using simulated gown, I'm using other equipment, the team behavior, the team attitude, it will be not as a real cases. They will not take care how to fix this mask, for example. But I have to balance. And I have to take this challenge in our consideration. We are working now to replace the real N95 mask with simulated one, similar to N95 simulated N95 mask here. The other challenge comes from the team, simulating team. Infection control team nowadays, they are in critical days. So busy. A lot of steps for them, a lot of tasks, a lot of meetings, a lot of patients, a lot of guidelines. So they don't have enough time to be with us for each simulation here. Each simulation drill, I believe their presence is essential also. But I cannot ask them, come for 1 hour every other day or every few days, for example, and they are so busy. I have also to consider this. The shortage now is not only in the equipment, the shortage also in our team here with the infection control team. Heavy task for them. This is a big challenge also.
طارق إذا ممكن تعيد الجزء الأخير لأنه النت فصل عندك. فإذا ممكن would you mind just repeat the last part لأنه النت disconnected.
Sorry. So the challenge was in the equipment and as well in our team, infection control team. They are so busy nowadays, so busy with a lot of tasks, a lot of meetings. They have heavy work nowadays. So not every time they are available for our simulation drill here. So they said, please, we cannot attend every other day for 1 hour for those simulation drills. This is another challenge. And I believe their presence in this simulation drill is essential also here to get improved. Their notes also and their remarks also is important for us. So that's what other challenge, add on the equipment. And we are also arranging now a schedule, maybe also once per week or at least once per week. We said at least once per week. It will be the minimum for us and the maximum for them. By simulation drill, we believe simulation add a lot on this COVID-19, add a lot for this heavy work for all the teams, but it will be one touch, checking also the preparation, the readiness for them also. Simulation overall, a tool to save life with the other health worker, with the other health provider nowadays. As we said, consider the scenario we started with. Scenario of Ahmed, he need surgery. As a real scenario, what will happen if the all other elective surgery get COVID-19 because these gaps not fixed before with extra filters, for example, or changing the pressure from positive to negative pressure room, as I start with our scenario here. Simulation overall in COVID-19 particularly and specifically is really needed to make sure that every steps is an optimal and perfect steps, because small gaps have sometimes significant effect, not only on the patient's safety, also on the health provider safety. We believe that this drill is supposed to be conducted in each hospital dealing with COVID-19 cases. That's our program. And I'm willing now to hear from you for any question or any further discussion for it. Thank you for all.
Thank you, Dr. Tarek, for this informative and well-prepared course. There is a question. The question from participant, one second, I'll just say the name. Ahmed Khobrani, Dr. Ahmed. So he was saying that, does the department surgery knows and anesthesia knows about the question that you're doing a drill? So because if they know that you're doing a drill, they will engage in an appropriate way. So I guess his question is, do you do it suddenly, or you aware the people about the simulation session? So this is one question. And the other question, he's doing something similar to that, and he announced to people that they're doing a simulation session, and he engaged the administrative and everyone. So what he's saying that he thinks this is the best way to gain interest between others. What do you think? So 2 questions. The first one, do you do it suddenly, or you engage people, and the engagement of the admin?
Initially, we thought that to do it as a surprise, not announce. But we said our goal to check the preparation. I'm not checking the personal knowledge, for example, here only. So let them know, let them we will prepare. Like any other cases, for example, come to the OR, they have to know that this COVID-19 come to them. Here, even though they are notified before that we will do this, but some gaps in the system is not related to the teams themselves, related to the system. We discover it here and we deal with it. We said maybe later on, after a few sessions, for example, we will make it as a surprise. But now the majority of our goals is related to the guidelines, to the system gaps, the preparation, for example, and the readiness of the our system overall. The team per se, let them to be aware, and the fear will be less, enough stress for them. This is what we thought about it. I'm doing surprising scenarios for other cases, not COVID. And I said, after discussing with our team, we will do even surprising cases, but maybe later on, not at the beginning for this. The second question from Dr. Ahmed Khobrani involving administration. Yes, they are with us from the day one of this, from the high level, medical services, and they attend, even the quality department, they attend the session, and they were surprised about some issues. Oh, this happened? Those people, they are doing the guideline, but theoretical. When you will go to the practice, this, you will discover a lot of points here need to be modified. The guideline itself modified after the first session in ER with attendance of the quality department. And the medical services from the day when they were with us give us authority to go to anywhere, to any other department, seal preparation. And even the report, it will be generated after that. Overall, what we are doing, because Dr. Ahmed asking an important question here, targeting a team, we are conducting debriefing after the session as any regular simulation session. We are conducting debriefing, discussing with the team what is the challenges and what they can get improved later on, what are the other area they can get improved. But from our side also, the other side, talking about the administration, we are generating reports, talking about the system issues, point after point, and we're reporting to them directly. Thank you, Dr. Ahmed, for this important question.
So just to rephrase what you're saying, you do it in two ways. One for the learners, so they can know how to do and what to do in case of cases. And the second one is actually simulation, system integration, just to, you want to test the system and see how the systems work.
Yes, exactly.
Right. He's saying thank you. Anybody have another questions? I have a couple.
Yeah, good.
Type. So I have questions. So how many scenarios you're doing, and are you changing the scenario? It depends on the area. What are you doing the same scenario or just different area to test the system? And what is the duration of the session? Because like we're trying to do the same. Dr. Sawsan is actually, Sawsan Al-Yusuf is the pioneer in this one. And from infectious point of view, the infection control, they limit the number in the room and they limit the duration. So I was wondering, like, how do you doing it? Do you have any control on time or duration, or how long do you run it?
Okay. Overall, the session, different scenarios. We made a different and designed different scenario, almost around 5 scenarios till now, and depend on the area what we are going to conduct a session in it, we are doing a scenario fit for them. So as I said before, scenario, for example, a patient come to the ER, I'm here looking for a triage steps, for example, how they are dealing with the case come with suspected COVID, simple scenario. More complicated scenario, come to the ER with severe respiratory symptoms, and the scenario here, the patient need respiratory support and advanced respiratory support. This is another scenario. Another scenario, intubated patient, for example, from ER, intubated in ER, get intubated in ER, and then transferred to the ICU of the transport issues. Other scenario, we did it in ICU. Patient intubated, came to us in ER, intubated to the ICU, and then accidental extubation in ICU. How's the reaction of the nurses? How many nurses they will enter the room, for example, to minimize the people in the room, and how many physicians, how many RTs. Again, here we discovered that 3 of our RTs with beer, and 95 is not fitness is not completed for them, for example. So we can see how many challenges we have it. The duration itself, from 0.0 till including the briefing, it took around 1 hour for its scenario. For that one in ER, I remember, in ICU and in OR, took around 1 hour, because here I'm waiting the actual steps. The chest x-ray, we are ordering chest x-ray. I'm waiting a technician to come to do chest x-ray. What's the steps they are doing, a technician, for example. It will take a longer time comparing with the other usual scenarios here. So, but overall, we are putting 1 hour as a duration target here, because longer than this, sometimes it will be boring for the team and make leaks sometime from the team, or they will not take it seriously.
Okay, thank you for sharing that. Anybody have a question? So thank you, Dr. Tarek, for your volunteering. And I would like to thank Dr. Abdullah Al-Marshad because he's the head of the scientific committee and he arranged this lecture. And I would thank all of you for attending the lecture. I hope it was useful. You will receive an email regarding, as you receive the link, the same email will come to you and they will ask you for the feedback. I think there is another question, 1 second, for the feedback of the lecture. There is a late question. He's saying 1 hour include debriefing. This is Hassan. He's saying, are you doing 1 hour include debriefing?
Yes.
So everything is going to be 1 hour.
Yeah. I cannot control the time exactly, but our target 1 hour because the time is related to the steps. The intubation, for example, I needed a real intubation because what we are doing is take our mini-can and this mini-can can be intubated. So, but overall, our target 1 hour, including the debriefing. Longer than this, it will be sometime boring for the other team members. Yes, including the debriefing. I remember that case in ER a little bit longer than, but for example, OR scenario, I remember it 1 hour, ICU scenario, it took around 1 hour. Overall, I want also to thank you, the Saudi Society for Simulation Healthcare. I want special thanks for Dr. Abdullah Al-Marshad and Dr. Amani Zahrani to be with us and organizing this amazing series of simulation for COVID. As well, I want to thank all the participants with us today and willing to have also, as Dr. Amani, willing to have the questions and the feedback. Also, I'm willing to have any feedback direct to me also. If you have any further question, you can contact us through Dr. Amani, and you are welcome also.
Or through the website, or Abdullah, or through anybody. We're here to help and facilitate. So if you do have any questions, if you have any suggested topic, if you have anything, please share with us. And as I'm not sure if you all will attend the previous webinar, you can find any, we have affiliation with the SSH Society. So all courses or all lectures or all updates regarding COVID-19, which is they have, you can find it in our website. And if you go to the main web page, you will find it clearly like COVID-19 material, and it will take you directly toward SSH. So thank you guys for joining. And this lecture will be also posted in our YouTube channel soon.
Thank you.
شكرا دكتور طارق.
Thank you. السلام عليكم.
يعطيك العافية يا رب. مع السلامة.